Hello, today we're going to be discussing the case analysis of Tramel. We'll first talk about his cultural identities as well as how our identities compare to his. We'll also talk about causes of his psychological pain, the amount of pain he has in initial diagnoses, and how his symptoms affect his functioning. We'll also consider the roles of his culture and etiology, and we'll end by talking about how therapy can help.
Okay, this is Tramel's cultural identity profile, and here we're just comparing what the dominant cultural identity is, and then across Tramel's cultural identity. So the differences here are that the dominant age is a middle age, Tramel is a young adult, the dominant religion is Christian, and then in Tramel's case study, we didn't see what religion he identifies as, if he does at all. And then the dominant culture is European, or dominant ethnicity, sorry, is European and white for race, but Tramel is Nigerian. The dominant sexual orientation is heterosexual or straight. Tramel is homosexual. And then the dominant SES or social class is upper, middle, or upper, and Tramel falls in the lower. The national origin are the same, so the dominant one is USA and Tramel is also from the USA, and then the dominant gender identity and expression is cisgender man, as is Tramel. So yeah, that's it.
There are a few ways in which my identity profile is different compared to Tramel's. For example, Tramel is Nigerian while I am white, and Tramel is homosexual while I am heterosexual. Through these characteristics, I may experience more privilege than Tramel. Based on these differences, he may feel vulnerable or nervous about sharing information with me and feel misunderstood when it comes to specific experiences he has. I'll make sure that Tramel knows that I'm an ally for individuals in the LGBTQ+ community by providing non-judgment, support, and empathy. I'll also educate myself in the Nigerian culture and try to identify how much Tramel identifies with specific areas of his culture. Lastly, I will directly ask Tramel how he feels having a white female therapist.
Okay, so I differ from Tramel in a few different ways. So I identify as Catholic, and then I am also Hispanic and half Mexican, half white. And then for my sexual orientation, I am heterosexual, and I know that Tramel is homosexual, so that might come up in therapy, and that might be something that we talk about, and I always want to make sure that he knows that this would be like a safe space to talk about anything that he would like to talk about and anything he's struggling with. And then lastly, I'm also a woman, and that may also come up in therapy, as I know that Tramel is a cisgender man, and I would just make sure that he knows that I'm open to understanding any of his point of views and that he feels safe with me.
There are a few different causes of Tramel's psychological pain. To start, his relationship with his family, primarily with his parents, has been unhealthy. By combining physical abuse from his father and emotional abuse from his mother, it takes a toll on his mental health. Tramel also faces discrimination and prejudice based on his cultural identities. He has had direct experience getting assaulted based on his sexual orientation and ethnicity or race, which has major implications on his well-being and feelings of safety. Lastly, his financial stress has been a factor as well. He reported that he does not manage his financial obligations in the ADL and also does not attend work consistently and on time.
So this is an overview of the amount of pain that Tramel is experiencing according to each assessment that he was given. So first, Tramel scored a 38 out of 60 on the BAI, which shows that he has severe anxiety, both somatic and psychological. His mental health problems appear to be very problematic regarding his life. He scored a 140 out of 180 on the OQ 45.2. All three subscales, symptom distress, interpersonal relations, and social role, were over clinical cutoffs, meaning that they were all heavily impacted. Also, he also seems to have minimal depression, as he scored an 11 on the BDI, and then he also had high post-traumatic stress symptoms from 58 out of 80 on the PCL-5. And then going on, for his potential diagnoses, we came to the conclusion that we think he has or would have acute stress disorder and not PTSD due to the fact that the significant traumatic event was 2 weeks ago. And so as a result, his symptoms could not have lasted for more than a month because for PTSD, one of the criteria is that the symptoms do have to last for more than a month to have a PTSD diagnosis.
Specific areas of Tramel's functioning are impacted by his mental health symptoms more than others. For his academics, he does not complete assignments on time. His GPA is not stable or rising, and he has no motivation towards a career. For his social life, he struggles with maintaining friendships, and his self-care is affected by him not regularly doing his laundry. The basic category on the ADL is his most affected area, as he answered no to all 4 questions. For example, he answered no to taking care of household responsibilities, no to doing most important household tasks well, no to managing financial obligations, and no to attending work consistently and on time.
Okay, here we're taking a brief look at the mental status exam for Tramel. We're going to be going over his basic functioning, cognitive test, and his suicide risk. So, as a brief overview regarding basic functioning, his eye contact was low, motor activity was also low, sleep was lower than normal limits, and then as was his mood. And then also regarding his basic functioning in regards to his emotion, they found that he was actually sad. As for his cognitive test, his active working memory is also low. His insight rating was low, as was his judgment rating. And then, as I'm talking about all these, you can see whenever I say low, it's regarding the downward arrows on this table. And then, lastly, regarding his suicide risk, it didn't seem like there was any immediate intent for suicide. There was a passive ideation, but there was not a strong risk regarding suicide. And that's it regarding the mental status exam.
It is important that we consider the role of Tramel's culture when examining his coping mechanisms, behaviors, and potential diagnoses. That being said, there are a few questions regarding his culture that should be considered before going forward with treatment. For example, for his sexual orientation, have there been stressors related to identifying as a homosexual? For example, bullies, his recent physical assault, microaggressions, etc. How has this affected him? And who has he disclosed his sexual orientation to? This could play a role in his coping mechanisms and relations to others. For his ethnicity/race, what stressors has he experienced related to his ethnicity? How does his culture cope with stressors? How does he cope? And how does this contribute to a potential diagnosis?
When examining Tramel's etiology or causes connected to his symptom distress and psychosocial functioning, there are a few factors that come into play. For example, his dad's experience of interpersonal violence and alcohol abuse, the abuse Tramel has experienced from his own dad, Tramel viewing IPV between his parents, and then his mom's emotional neglect as he was growing up. These are all factors that have played a role to Tramel's symptom distress and now psychosocial functioning today. Lastly, the stressors related to his recent traumatic event and his ongoing discrimination against his race and sexual orientations have also played a role and were apparent in his case study. So from these events, Tramel might have learned to cope, interact with others, and even be closed off emotionally due to these factors that I had just mentioned. These factors also may interact with any potential biological factors already present in Tramel, which all kind of play a role and interact with each other to create his symptoms and functioning today.
So how can therapy help Tramel? First, it can help him work through trauma and see how it has impacted his mental health. It will also allow him to work on his family relationship, which may grant him the social support that is necessary for working through any cognitive distortions and maladaptive behaviors. And finally, it will help lower his symptoms related to worry and disturbing content of dreams, sleep aversion, lethargy, and misuse of caffeine. Hi, Tramel. How are you today?
I'm pretty good. How are you?
I'm good, thank you. So before we dive into things, I'm first going to talk about what we'll be doing today, so kind of set an agenda. So we're first going to talk about counseling, what it is, what it's going to look like with me, and confidentiality. And then we're also going to discuss treatment, so what goals we have for the treatment together and specific recommendations that I have. So do you have any questions, or is there anything specific that you want to cover today?
I just have a few things that I wanted to talk about that have just been like kind of troubling me, I guess. I just feel like I worry a lot and haven't really been able to sleep. And I just recently went through something that has kind of impacted me a lot, and my relationship with my parents just isn't very good. So I just kind of wanted to touch on a few of those things today or going forward.
Okay, sure. We'll definitely add that to the list and talk about the current problems that you're having. All right, so now I'm going to talk a little bit, like I said, what counseling is and going to kind of give you a definition. So it's a collaborative process between the therapist and the client. The therapist helps the client develop goals and solutions to struggles that they're facing. They also work to improve the client's well-being, coping skills, symptoms of distress that they have, and promote positive change in the client's life. So people see therapists for a variety of different reasons, such as like mental health issues, interpersonal problems, school troubles, and so on. Does that all make sense to you?
Yeah, it definitely does.
Okay, perfect. So therapy looks different depending on the therapist.
Mm-hmm.
And with me, I don't tend to stick to like a specific orientation. I guess you consider myself an eclectic. So instead of doing one orientation, I like to do whatever is most empirical, or what works the best for that person and problem. I also think it's important that the client feels comfortable and that they can talk to me about anything, but also I don't push them to talk about anything specific. And I think it's important that we also focus not just on the pathology or the problems that you have, but also improving your daily living.
Okay.
Do you have any questions about that?
Not at the moment.
Okay. So we're going to move on then to talk about confidentiality. So there's mostly you can talk about anything. You can talk about anything with me, but there are some things that I might have to break confidentiality and report, such as like, for instance, if you talk about child abuse, elder abuse, intent to harm yourself or intent to harm others. If I have knowledge of certain crimes that like you might commit, or if others might commit, and then I also sometimes might have to provide like information about diagnoses or other important information to third-party payers. So it's important to remember that I'm a mandated reporter for like child abuse, elder abuse, and I would have to break confidentiality if you shared that information with me. Does that make sense?
Yeah, I guess my only question is like, when you say third-party payers, do you mean insurance companies?
Yeah, I mean like insurance companies if you receive assistance from them.
Okay.
With payment.
Cool.
Yeah. All right. So we're going to move on to talking about goals for the treatment. What specifically do you hope to gain or work on in therapy?
I feel like first off, I really want to work on like my relationships, whether that be with like my friends and really my parents at this point. And then also just like overall, like I feel like I don't know if my coping mechanisms are the best. Like I haven't been sleeping much, so I've been drinking a lot of caffeine, and I know that's not necessarily good for you. And so I don't know, and I've just been feeling kind of down lately. And that event that I had mentioned earlier, I feel like has affected me, and I'm still trying to figure out exactly how, but I definitely noticed like a change in my reactions, my mood, my emotions, and all of that. So I just kind of want to weed through all of that and improve my mood and address those symptoms. And I'm still trying to figure out like what exactly they are.
Okay. So if I'm hearing you right, you kind of want to work on your relationship with others. You
Mm-hmm.
also want to work through the event that happened and kind of process your emotions, but also, I guess, improve them. And you also want to help your daily living problems like the sleep and
Yeah,
stuff like
exactly.
that. Okay, good. Well, we'll definitely work on those things. I also think it's important that you work on increasing your emotional connection with yourself so that way you can increase the emotional connection kind of that you talked about with other people.
That makes sense.
Um, Also, we will want, kind of like you talked about, we'll want to lower or decrease the symptoms that stem from the traumatic event that you talked about.
Mm-hmm.
And lastly, I know you kind of talked about your parents, so we'll definitely want to process the relationship with them. Um, what specifically about the relationship do you think needs to be improved?
I'm not sure if it's like something that we can really get into today,
Okay.
but I've just been through a lot. I've witnessed some things that weren't the healthiest between the two, and just the way that my dad has treated me and my mom has treated me. They both have treated me very different ways, and I know that both ways were unhealthy and something that needs to be addressed. But like I said, it's just a lot that I feel like we can't all touch on
Mhm.
with this time that we have today.
No, that's understandable. And I noticed when you were talking about that, you kind of like rubbed at your chest a little bit. Are
Hmm.
you feeling like nervous or uncomfortable about talking about this?
A little bit, because it's not really something that I've talked about with my friends or anything. So it's just something that I've kind of kept to myself, and that's
Mhm.
probably why I felt or looked nervous.
No, that makes sense. This is difficult stuff to talk about, so you have every right to feel that way. But do those treatment goals sound good to you? Is there anything missing?
They sound good to me. If anything else comes up that I think of, I'll definitely let you know. But for right now, I feel like those are good goals going
Okay,
forward.
perfect. All right, so now I'm going to talk a little bit more about the specifics for the treatment recommendations that I have. So when you go through traumatic events like you've experienced, your body is definitely changed after that, and it kind of goes into a mode where it's always in fight or flight. So it's always kind of ready on on guard, I guess you could say.
Mhm.
So to work through that, we'll definitely learn relaxation techniques to get your body out of that state. We'll also want to discuss and work through the traumatic events and experiences that you've had and the thoughts and behaviors that have resulted from those experiences. And it's up to you, but it might also be beneficial if you went on maybe some medication to help with some of the symptoms that you have, like the sleep problems, mood, focus with school and everything.
Okay.
So I'm curious about your reaction to those recommendations.
I think they all make sense. I'm not sure about like what kind of medication I would need, but it's definitely something that I would be open to. I know that that's something that a lot of people are now doing and it's been helpful. So that's definitely something that I'll be open to, and I'm excited to uh like go through these specifics. Like the relaxation one I really liked because like you said, like my lack of sleep, um and I even kind of avoid sleep, and so I feel like the relaxation part would be super beneficial and hopefully like help with my sleeping because it's been something that's been going on for a little bit now.
Yeah, the relaxation should definitely help in many different areas of your life, and you definitely do not have to go on medication, and we'll discuss that further about like certain side effects that might occur and how you're feeling about it. But yeah, do you have any questions about those at all?
um
Otherwise,
no,
no.
that's really it. Thanks
Okay.
though for explaining all of that.
Yeah, no, of course. So through this meeting and with other background, I noticed that we come from different cultural backgrounds and have different cultural identities. So I'm wondering how you feel about working with myself, white European American woman.
Oh, well, like what I think
Yeah,
about
what do you
it.
think about it?
um I mean, I have no problem with it. I had no expectation of like who my counselor was going to be or anything like that. So I don't see any issues with it. It's definitely something that we might have some differences that come up, but that's okay with me if that's all right with you.
Mm-hmm. No, of course. No, that's good because yeah, it's always important to make sure that your needs are met and heard. And I mean, coming from different cultural background, I might not understand everything and you might not understand my experiences, but as long as you feel comfortable moving forward, I think that we'll definitely be able to work together.
Okay. Well, I'm excited to go forward and hopefully I get better.
No, you will. Okay. Thank you so much.
I'll talk to you again next
Yeah.
week.
Yes,
Okay.
perfect.
Sounds good. Okay. Is it recording? Okay. Okay. Hi, Tramel. How are you today?
I'm doing well. How are you?
I'm pretty good. Can I ask you a little bit about what brings you in today?
Yeah, I guess I have a few different concerns. I've been having problems like sleeping lately and both like getting asleep and staying asleep. And then, I don't know, I had like kind of a bad experience happen like not too long ago and it just kind of left me feeling a little bit different. Like my mood is down and I just don't really feel like doing very much or just like, I don't know, I just feel different and like anxious a lot and um, maybe work on like my relationship with some other people, I guess.
Okay. Is there anything else other than that for right now?
No, I think that's it.
Okay. Well, that's definitely something that we'll talk through and we'll work on as we go through therapy, and hopefully we can resolve some of the things that you're hoping to resolve.
Sounds good.
So, for today, since this is our first time meeting, I'm going to talk a little bit about kind of what counseling is, what counseling looks like with me, um, the limits to confidentiality that I have. We'll talk briefly about some treatment goals going forward and some more specific recommendations before we leave here today. Does that sound okay?
Yeah, that sounds great.
All right. So, counseling in general, it's definitely more of a collaborative process. Like I'm here to listen and to help you, and we work together to create goals that we both think that would help you best for your daily life in the long run, anything like that. And then we will talk about anything that you want to talk about. We'll talk about ways that you have been coping, other ways to cope, and anything like that. And then we'll also talk about any issues that come up during the week that you're not in session, and then we can address those whenever you come back. And so that's really just what counseling is. It's more collaborative, and every session we'll set an agenda and go through as much as we can and resolve any issues for that day. Does that sound okay so far?
Yeah. Mm-hmm.
Do you have any questions regarding counseling in general?
No, it sounds like what I thought it would be like, honestly.
Okay. Sounds good then. And then I guess a little more specifically, counseling with me, and what that looks like. I'm honestly I'm a very open person. I'm open to whatever you want to talk about, as long as we're going towards our goals, of course. And I'm just here if you want to talk that day, honestly, because talking in general is very therapeutic. I'm also here to, like I said, listen. We're going to problem solve. We might also talk about the kind of thoughts that you're having and how you may be acting on those. So, like your different behaviors. And we'll figure out going forward if we need to change any of those thoughts or behaviors to help you in your day to day. And that might even improve your mood as well going forward. So does that sound okay regarding what counseling with me looks like?
Yeah, I think it sounds pretty reasonable.
Okay. And then also another thing, sometimes I'll add, because I'm not a specific, I don't have a specific orientation like some counselors do. So I might add in some things that I might think are beneficial as we go forward, like relaxation techniques or mindfulness techniques or anything like that.
Okay.
So I guess next we should also talk about the limits of confidentiality when we're in counseling. This is something I have to talk about just in case anything that comes up during our session, and I may have to report it because I am a mandated reporter. So some things that I have to report is if like you tell me that you're going to harm yourself and you have this plan and I know you're going to do it, or you're going to harm another person, anything like that. I also have to report any elderly abuse that you talk to me about, child abuse, and there may be instances, it depends on your third-party payer, if I need to disclose any information regarding like your diagnosis or anything like that. Does that sound reasonable to you?
Yeah, it wouldn't be any other like specific information to the third party payer, right? Like
It's only what
general.
it's only what they need, and it's like we wouldn't release any therapy notes or anything like that. That's not allowed. So it's just whatever they need regarding a general like diagnosis.
Okay.
And then I guess next I wanted to talk about, before we go on to our treatment goals and specific treatment recommendations, I just wanted to touch on the fact that we have different cultural backgrounds, and that may come up in therapy. And I just want to acknowledge that I understand that I may not fully understand everything that you're going through, but I'm here and open to anything that you want to talk about. This is a safe space. And I do want you to feel safe when you're talking to me. I don't want you to hold anything back because you think I might judge you or anything. That will never be the case. So I just wanted to make that clear. Do you have any concerns regarding like my background? Like, I know that I'm a woman, I'm Hispanic, and I'm your therapist too. So is this something that you see like as a problem? Is there something that you want to talk about regarding our different backgrounds, or are you okay going forward?
Yeah, I mean, I noticed that we come from like we have different identities and everything, but I mean, I feel pretty comfortable with you already, and you seem like you're pretty approachable, and I mean, I'm sure you've had like education about this kind of thing anyway, working with different kinds of people, so I feel good about it.
Okay, good. Yeah, I can already even see that you you are comfortable opening up to me about how you feel. So I'm glad. That makes me feel good going forward.
Yeah.
So next, let's just talk quickly about your overall treatment goals that we would have. So I know that you talked about your lack of sleep and staying asleep, and your different relationships. So let's get a little bit more into depth about that. So along with that, what are your primary concerns that you would want to talk about in future sessions?
I guess my relationship with my parents, I've witnessed things that a lot of people don't witness happen between their parents. And I guess that's kind of influenced not only their relationship, but my relationship with both of them. And I guess my relationship maybe with other people too. So I think that might be important to talk about. And also just getting through these feelings lately, especially from that have like stemmed from the like events that I've been through.
What kind of feelings are you referring to?
Bad feelings like I don't know, I just don't feel like I said, like doing much. Like my school's been like affected by it, and my like motivation to do schoolwork. I've also had like financial stress, which has made things worse. And I don't know, I feel overwhelmed with a lot of things, and just not in a good mood a lot.
Okay. So if to, I guess, quickly summarize, you said, just so I have this right. So your relationship with your parents, that's something that you want to work on, right? And then your lack of sleep and that recent event that you've gone through has been affecting your mood and probably other aspects of your life. So these are something that we need to keep in mind when going forward when in our sessions when we're talking. Does that sound all right? Is there anything that I'm missing?
No, I don't think so. That was a pretty good job at summarizing it.
Okay, so I guess like our goals for right now, really we want to improve that relationship with your parents, correct? We're going to process that. We're going to talk about what's going on there and what can we do to problem solve that. And then also we want to address your sleep, your lack of sleep. I said maybe we can do some relaxation techniques to do that. We want to improve your mood, and that'll help your everyday life as well. And then I also wanted to touch on maybe throwing another goal out there, like improving your overall emotional connection with yourself. So that way it'll be easy to apply those emotions and have that connection with others. Does that sound okay as a goal for you?
Yeah, I think so. That would definitely probably help, honestly.
Okay. And then I guess another one would be to decrease those like bad feelings that you said you were having, and any other like kind of like bad like symptoms or anything else that you're feeling that's probably coming from that event that you had just experienced, and addressing those and working through those and improving those symptoms as well. So do those goals okay for you so far?
Yeah, I definitely think so.
Okay, is there any other goals that you kind of want to add?
Not right now. Maybe as we like go through it and everything, keep going.
Okay, sounds good. And so I guess going off of those goals regarding treatment, like I said, I do want to talk about the kind of thoughts that you're having and addressing those, because those do affect your everyday behavior. And if you are having kind of like any negative thoughts, we want to address those, change those, and replace them with more positive thinking. So that way, your like everyday tasks and things that we need to work through are easier for you. Does that kind of make sense?
I think so.
And then that'll apply like working on relationships with your parents and anybody else that we want to address. So we'll kind of problem solve through that and think of different ways to help with that, like whether that be trying to talk to your parents, or if you're not ready to talk to them about your feelings, we can write things down that you want to talk about and then talk about how you want to apply that and see what you want to do about talking to them, because that's not something that I want to push you to do. I don't want you to feel uncomfortable about doing everything right away, like we have to do a quick fix. Like, no, like this is something that we will work through together, and I just want you to feel comfortable throughout the process.
Okay.
And then also, I do also think it's important to talk about your current coping strategies and any other strategies that we might want to implement going forward, whether we want to replace or add coping strategies that might help you process your emotions and make you feel better. Does that sound all right to you?
Yeah, I think so. Yeah, some of my coping is kind of maybe not be the best, so I think it would be good to work on.
No, that's totally understandable, and we'll talk about that in the next session if we want, and see what we can do about that, and if we want to change any or add any. I think that'll be a good idea.
Okay.
And then lastly, I know that you mentioned the event that you recently went through that has kind of affected your mood and just everyday life. I do want to talk about that and work through that, if that's all right with you. It doesn't have to be in the next session. It could be in the next few sessions. But I do think it's important that that's something that we need to talk about, and we may want to identify any upcoming like triggers or current triggers that remind you of that event, because those can have an impact on your mood and concentration and anything like that. So I think that'll be important to talk about and work through, because it's something that we can prevent from getting any worse, like your symptoms. This is something that we can talk about now and address now, so that way we can prevent any like worsening symptoms or anything like that.
Okay.
And so that was really it for right now. Those are just like kind of brief goals and recommendations that I would want to do. And I know that going forward, like if there's anything that you're uncomfortable with doing or aren't ready to do, like I just want you to let me know, and we'll think of something else that we can do instead to work towards our goals and everything.
Okay. Sounds good.
Okay, is there any questions that you have overall about anything I've said today?
No, I definitely feel more comfortable moving forward and with all that information.
Okay, well, I look forward to talking to you in the next session, and I hope you have a good rest of your day.
Thank you. You too.
Thank you.